My name is Robert Marcus. I'm a consultant haematologist and I have a special interest in lymphoma. Lymphomas are tumours of the lymph glands which start in the lymph glands but may spread to other organs. Both Hodgkin and non-Hodgkin lymphoma are cancers of lymph glands. They differ because they look different under the microscope. Hodgkin lymphoma is mainly one disease in younger people. The non-Hodgkin lymphomas are cancers of lymph gland, all of which behave differently and require different kinds of treatments. The commonest symptoms of lymphoma are those of painless swelling of the lymph glands, and this can be in the neck, under the arms and the groins. It may be accompanied by sweats or fevers or weight loss, or in Hodgkin lymphoma, occasionally severe skin itching. If the lymph gland enlargement is in the chest, patients may have cough or shortness of breath, and if the lymph gland enlargement is in the abdomen, in the tummy, then patients may have abdominal swelling or pain or constipation or diarrhoea.
My name is Linda and I was diagnosed with a type of non-Hodgkin's lymphoma. I first felt something was a bit wrong when I was washing vegetables in cold water. My fingers would feel tingly, itchy, they turned red to white, and it worried me. I didn't immediately go to the doctor, but later on I went to find out what was wrong.
In most people, we don't know why they get lymphoma. Patients, for example, on long-term drugs which suppress immunity, or if they've had a transplant of heart or lungs or kidneys, they have an increased incidence of lymphoma. And patients whose immunity is reduced by HIV may also have an increased incidence of lymphoma. But in most patients, we don't know why they get this disease.
When I went to the doctors, he thought that the symptoms I presented him with were a little strange, and he decided it was best to go for more blood tests. My GP sent me to the haematologist, and she was the one who gave me the diagnosis within about 2 or 3 weeks.
Lymphoma can only be diagnosed by taking a biopsy of the lymph gland. That means taking either a sample from the lymph gland or by removing the whole lymph gland and then looking at sections of it under the microscope. Once you've made a diagnosis of lymphoma, we need to know where else the lymphoma might be. So we need to do a CT scan, or more recently a PET CT scan, to establish where else there might be enlarged lymph glands. We also sometimes will want to do a bone marrow test to see if there are any lymphoma cells in the bone marrow, and occasionally a lumbar puncture or an MRI scan to see whether there are any lymphoma cells in the spinal fluid or in the brain. We'll also need to do some blood tests to make sure the patients are making their blood normally, and we'll also want to assess them for viruses such as HIV and hepatitis to make sure they're not carrying these viruses before we start any treatment.
When the haematologist told me that I had lymphoma, I had no idea what that was, and I had no inkling what it would mean to me. When I was diagnosed with lymphoma, I was actually on my own, and it was quite a shock to me, and I didn't know how to react. The haematologist tried very hard to explain to me what the lymphoma was, even drawing me a diagram. Unfortunately, I was in such a state of shock still, I couldn't take it all in and didn't really fully understand it. The haematologist was really caring and understanding, very sympathetic. When she told me I had lymphoma, she didn't actually use the words cancer, and that was helpful because I didn't get that initial shock, which you might get when you hear those words.
Once you've had a diagnosis made, and after the patient's been appropriately staged, meaning we know where the disease is and what kind of disease this is, you'll then go to see a haematologist or an oncologist, and there'll usually be a clinical nurse specialist with you to discuss the treatment plan and what happens next.
My haematologist actually put me in touch with Macmillan, so I knew of their services, and she also told me I could get in touch with a specialist nurse if I had any questions or worries. And my main support apart from that was my husband and my sister. I was able to come to terms with the diagnosis because I continued to go into work and doing the normal things that I enjoyed, but also more importantly I had the support of my family and friends.